So what is a decisive moment? A decisive moment is the moment where you show yourself and the world who you really are, what you really value. Not what you like to think you value, not what you'd like to think you believe in, but actually where your revealed preferences, as we've discussed over the last 2 days, become clear to the world. And in healthcare, that's the moment where all of the process questions and all of the institutional questions and all of the competitive questions get stretched aside, and you focus actually on the expression of your core values. And while of course it's true that sometimes those decisive moments are moments that we choose in times of calm or in times of reflection when things are going well, I would say that it's also equally true that decisive moments are often thrust upon us. We don't choose the moment of that cancer diagnosis. We don't choose the moment of the dissolution of your relationship. We don't choose the moment where your institution is under threat. But when those moments present themselves to us, we learn something about who we are and what we believe in. In 1865, a young woman named Emily Stowe applied to be admitted to the School of Medicine at the University of Toronto, where I live. And she received a letter back, and in writing, the vice president of the Toronto School of Medicine said, and I quote, "The doors of our university are not open to women, and I trust that they never will be." I want you to just put yourself in the shoes of that young person for a moment and ask yourself, honestly, what would you do? What would you do if your dreams for your own future had the door slammed in their face in that way? What do you think your response would be? Well, luckily, in that decisive moment, Emily Stowe, I would say, did something much more brave than many of us would do. She packed up her bags, she went to New York, thank you, America. She got her medical training, and then she came home to Toronto, and she opened Women's College Hospital, the first version of which you can see in the right-hand part of that slide. And at the time that she opened her own hospital and started her own nursing school and her own medical college, that building housed 7 beds, 15 doctors, and 1 nurse, and they were all women. It was the first place of its kind in the country, and it has continued to be an organizational trailblazer for women leaders and for women patients in our health system to this day.